Hi, I'm Dr. Mahima Rahman, Ayurveda and CPD expert. So today's video we will be discussing about bladder cancer. Bladder cancer is a type of cancer that begins in the cells lining the bladder, which is a hollow organ or a bag kind of a structure in the pelvis responsible for storing urine. It is one of the most common cancer affecting the urinary system. Bladder cancer can occur at any age, but it is more common in older adults. Now let's understand what are the types of bladder cancer. Transitional cell carcinoma or urothelial carcinoma. This is the most common type of bladder cancer which originates in the cells lining the bladder. Squamous cell carcinoma. This type of bladder cancer develops in the thin, flat cells that can form in the bladder lining due to chronic irritation or inflammation. Adenocarcinoma is the third variety. It's a very rare type of bladder cancer, starts in the glandular cells of the bladder lining. Now let's explore what are the symptoms of bladder cancer. Blood in the urine, that is called as hematuria, which may be visible or detected only under a microscope. Frequent urination or urge to urinate without producing much urine is the second symptom. Pain or burning sensation during urination, pelvic pain, back pain, changes in bladder habits such as increased urgency or frequency. These are the common symptoms. How do we diagnose bladder cancer? Urine test. Urine samples are examined for the presence of blood, cancer cells or other abnormalities. Cystoscopy. A thin flexible tube with a camera is inserted into the bladder through the urethra to visualize the bladder lining or any sorts of abnormalities in the bladder. Imaging studies such as ultrasound, CT scan, MRI or intravenous pyelogram IVP may be performed to assess the extent of the cancer and determine if it has spread to other organs. Biopsy is a full process example to confirm the condition. A sample of bladder tissue is taken during cystoscopy or surgery and examined under a microscope to confirm the presence of cancer cells and determine the type and the grade of cancer. How do we manage bladder cancer in conventional system? Treatment options for bladder cancers depends on factors such as type, stage of cancer, overall health, patient's preference, etc. But common treatment modalities include surgery, transurethral resection of bladder tumor, TURBT, or partial cystectomy or radical cystectomy, that is removal of the bladder, may be performed depending on the extent of cancer. Intravesical therapy, medications or immunotherapy agents may be delivered directly into the bladder to destroy cancer cells or prevent recurrence. Radiation therapy, high energy rays are used to kill cancer cells or shrink tumors, often used in combination with surgery or chemotherapy. Chemotherapy, drugs are used to kill cancer cells or stop their growth, either intravenously or directly into the bladder. Immunotherapy, immune checkpoint inhibitors such as medications such as acilozumab may be used to boost the body's immune response against cancer cells. You need to follow up regularly. Regular checkups and testings are essential to monitor for cancer recurrence or progressions. Early detection and prompt treatment of bladder cancer are crucial for improving outcomes and reducing the risk of complications. It's important for individuals experiencing symptoms suggestive of bladder cancer to seek medical emergencies immediately. Now let's understand in Ayurveda how do we consider bladder cancer. So in Ayurveda perspective of bladder cancer, according to Ayurveda, bladder cancer is caused by an imbalance in the three doshas, that is Vata, Pitta and Kapha, and poor digestive system. The toxins accumulates in the body due to improper digestion, leads to formation of tumors in the bladder. Ayurvedic treatment for bladder cancer involves cleansing the bodies of toxins, that is detoxification therapies or panchakarma therapies, improves the digestion, that is improving the Agni, and restoring balances to the doshas. This is achieved through a combination of herbal remedies, panchakarma therapies, dietary changes and lifestyle modifications. So the commonly used herbs are turmeric, ashwagandha, gugulu. These are commonly used in Ayurveda to do cancer. In fact, any type of cancer. In addition, a healthy diet that includes plenty of fruits and veggies and as well as whole grains is recommended. Lifestyle changes such as stress reduction, regular exercises, and adequate sleeps are also important in preventing and treating bladder cancer from an Ayurvedic perspective. Now let's understand what are the preventive methods which you can take to control the bladder cancer. In first step, we must understand that there is no foolproof way to prevent bladder cancer or any type of cancer, but there are several steps that you can follow to reduce your risk of developing the disease. Let us share some of the easiest steps that you can keep bladder at a good stage. Prevention of bladder, first and foremost thing is to stop any kind of addiction. If you are having any habits of smoking, drinking, quit smoking and drinking. Drink plenty of water, love your bladder. Limit exposure to harmful chemicals. Eat a healthy diet. Do extreme physical activity whichever is required to your body to stay physically active. Practice good hygiene like proper passage of urine. Don't hold your urine. Use properly cleaned and good urinals or bathrooms when you wanted to go to the restroom, and get regular monitoring. These are the practices which you can do to avoid any sorts of cancer, specifically bladder cancer. Thanks for watching the video. We at ZenOnco are always there by your side during your cancer journey. Any cancer related query you can inquire with our cancer coaches in the below given number.